So thank you to everyone for joining. We had an amazing response to this webinar. As I mentioned, it's the very first ISCoS webinar focused for OTs by OTs. My name is Fiona Breytenbach. I'll be hosting this session, and I'm joined by two moderators and two speakers who I'll introduce shortly. We felt that it would be beneficial to host a webinar on tips and tricks for your spinal clients. These tips and tricks have been gathered from several sources, which we'll list at the end of the presentation. But as we often find in OT, these have mostly come from the experts themselves, the clients. Whether you are new or experienced in spinal rehab, and whether you come from a high or low income country, hopefully you'll be inspired with some new ideas by the end of this presentation. Just a bit about myself. I'm a lecturer at the University of the Witwatersrand in Johannesburg, South Africa. I'm currently working as a lecturer and course coordinator for the undergraduate and master's adult neurology modules in occupational therapy. Prior to academia, I worked in an acute central level hospital in a trauma unit where I mostly treated head injuries and traumatic spinal cord injuries. To introduce our two moderators who will be monitoring the Q&A section and admitting those joining our webinar, we have Nikki Hunter and Arifa Yahan Emma. Arifa is a Bangladeshi-based OT. She's currently working as a lecturer and course coordinator in the MSc Occupational Therapy program at Bangladesh Health Professions Institute. Prior to this, she worked full-time in spinal rehab and is currently involved part-time. She's published research on the post-rehab education and job participation of individuals with spinal cord injuries. She's been working with the ISCoS OT Special Interest Group since 2021. Nikki currently works as the coordinator for spinal OT services in the statewide spinal unit in Perth, Western Australia. She has extensive experience in inpatient, outpatient, and outreach services across Australia, having worked in 3 different states in the field. Thank you to Nikki and Arifa for helping moderate this session. I'd also like to just introduce our two other speakers before we start, Nica Pietersen and Candice Smith. Nica graduated with her BSc and MSc in OT from the University of Witwatersrand in Johannesburg, South Africa. She's worked in a government rehab facility with a large focus on traumatic spinal cord injury, and then moved on to work at a private inpatient rehab facility where she worked in the specialized spinal unit and the brain injury unit. She now works for home-based physical rehab practice with a greater focus on home and community reintegration. Candice graduated with her undergrad degree in OT from the University of Pretoria in South Africa. She has worked in a government rehab facility, and thereafter she moved into private practice doing inpatient rehab for various neurological conditions. Her passion is working with patients with spinal cord injuries and wheelchair seating. She is a committee member of the South African Spinal Cord Association called SASCA, and is involved in a tendon and nerve transfer clinic for quadriplegics. So I'm really honored to be joined by such esteemed colleagues. Just having a look at our hour ahead, we'll be focusing mostly on home and community reintegration. Due to time constraints, we can't cover every occupational domain, but with the main topics, we're looking at home access, self-care tasks, home management, electronic communication, leisure, sexual functioning, and child rearing. For community reintegration, we'll be looking at getting your clients out and about, shopping, traveling, working, driving, and reading. And lastly, we'll touch on the endless possibilities when it comes to 3D printing. The last 15 minutes are dedicated to a Q&A session. So please have your cell phones out and ready. We have a few QR codes in the presentation, which you can scan with your camera, and it will link you directly to that website to give you more information. So please make sure to pop your messages into the Q&A, into the chat as they arise, so we can address them at the end. All right, over to Candice.
Guys, so we're going to have a look at home reintegration at the moment. So before we go on, I just want to highlight a few things that we need to remember when looking at home integration. I think we froze. There we go. So inpatient rehab is focused on the learning of skills. Home integration focuses on transferring those skills to the home environment, reviewing and adapting the ADLs once again to ensure adequate integration. There will be a greater focus on IADL participation in para and lower level quadriplegics, and then greater focus on participation in meaningful activities for higher level quads. So now moving on to home access. A useful tip for all wheelchair users is to add a remote control function to the front door, making accessibility into the home easier, especially in the event that the door is followed by directly after a ramp. A low-tech version to opening and closing the door includes placing a simple grab rail onto the door to make it easier to handle. Now, next is something that is often addressed early on in rehab, eating. And we often start using a universal cuff using a spoon and fork in a universal cuff. But once the patient goes home, spoons and forks comes in all shapes and sizes. And if a patient loses it or forgets it somewhere, then they've lost their independence. This is a quick video showing how a C6 quad is able to eat with a fork, spoon, and cut with a knife without using assistive devices like a universal cuff. The link for the full video on YouTube is available at the end of this presentation.
Fingers, and I will go like this, and I'll put it through one finger, on my index finger. So as you can see, like that. So once again, I just hold my spoons just like that on top of my thumb knuckle, and through the index finger and up through there, and then I'll just go like this, and I'll go like that, and then eat it, whatever, like that, through between middle finger and index finger.
Oh dear, I think it froze.
And out toward my thumb like this, and up and down. And I will use this other hand to put on top of the handle like this to give it force. So I'll just go like this, and then I'll move it down and back and forth like that.
So looking at eating and drinking, especially for high-level quadriplegics, a useful tip is, especially for C4s, to drink water independently, is to use a camelback with a mouthpiece nearby or mounted to sip from. Looking at some ways to manage medication, a simple modification of an insulin syringe makes it possible for a person with extensive disabilities to give themselves a shot. A person without dexterity can use their tenodesis grasp to open a medication tube from their dorset and then place it into a bowl or plate as shown in the picture above. They can then dampen their thumb to pick up the medication from the plate and then drink it using a cup with a straw. Moving on to oral hygiene, when addressing teeth brushing, there are a few suggestions and tips to enhance independence. Using a flip-up toothpaste tube rather than a screw top, or using an electric toothpaste dispenser. You can drink water from a straw to rinse your mouth, and using an electric toothbrush with an enlarged grip or cuff if this is necessary. Applying makeup. So as shown in the pictures that are going to be presented now, she's using a tenodesis grasp to put on eyeliner and blush, and she's stabilizing the heel of her hand against her cheek. You can see here that she's also using her other arm to hook around her wheelchair to maintain her balance and stabilize herself. And then her makeup products are sitting on her lap. Cooking. So there's quite a lot of information around cooking and adaptation. So we're just going to highlight a few things. So getting something like an adapted chopping board and utensils to make sandwiches and cutting vegetables easier. Non-slip mats prevent sliding of plates and cutlery. Using electric salt and pepper dispensers to add spices to food. Considering the type of crockery and cutlery you buy is also essential in making cooking easier and safer. Like getting glasses that have a double layer can minimize the risk of burning yourself when drinking tea or coffee or something warm. and adding something simple such as a keychain loop to a drinking bottle can make it easy to open, especially when your hand function is limited. If you are fortunate enough to have an adapted kitchen, having slide-out drawers is easier to access pots, plates, spices, etc. You can use a trivet to slide your hot pots from the stove to the basin, as this will reduce your risk of burning. You can use a basket on top of your lap to transport groceries from the fridge to your working surface instead of doing multiple trips, and using a simple tool from the garage, like in the image above, to move the grids in the oven to prevent yourself from burning. Now looking at laundry, a task that we all, I'm sure, love doing. Using an ironing board that can fold down and flip up from the wall makes it convenient to do ironing. It also saves a lot of space. If a person has the means to adapt their home to make an accessible laundry room, this will enable more independence. Having a washing basket on wheels makes it easier to transport washing around the home. Alternatively, just elevating your washing machine on bricks is a low-cost way to make the washing machine more accessible. And using fold-out clotheslines or drying racks will make it easier for you to hang up washing. Moving on to electronic communication. So using baby monitors is a very effective way for quads to call their caregiver when they need assistance, instead of relying on bells or other mechanisms that require hand function. NFC tags are small, inexpensive, and easily accessible white round tags that you can stick anywhere in your house. These tags can be easily programmed by a therapist or family member to perform simple functions on your phone by just tapping your smartphone against it. This is particularly useful for quads with no hand function because you don't need to press any buttons. If you've used Apple Play, this is NFC technology. You can, for example, have an NFC tag on a patient's bedside, and it has a preset message that will send a text or WhatsApp message to his girlfriend to call him. You could also put one near the toilet for if they need assistance from their caregiver, or ones at certain places in and around the home if they're feeling unsafe or they need it to access emergency services. Then for handling your cell phones, placing a keyring on the back of the phone allows for independently holding the phone in one hand while manipulating it with the other hand. This is a very low-cost option and is also regarded as fashionable for your younger quads, and this is maybe a nice step towards adapting equipment that isn't so visible and it's possibly less intimidating for a newer injury to use. So leisure is a very broad aspect to cover, so we are just highlighting a few activities that can be adapted. I really encourage everyone to have a look at the Spinalis Tips website for activities that is very suited to your individual patients, as leisure is very individualized because there are activities from water sports to air sports, you name it. So over here, we're just going to look at, for those with limited hand function, there are a few ways to get creative. Getting an extended pen holder that you use your mouse to manage to draw or paint. Getting a document holder with a table bracket to hold your papers. Here's an image of a lower level quad holding a pencil with a glove and an adapted grip to do sketching. Having a handheld computer or tablet with a touch screen is another easy way to entertain oneself with games or reading ebooks, etc. For beach lovers, getting around the sand with a wheelchair, as we can know, is all quite a challenge. So this can easily be overcome by using 2 hard foam exercise mats, as in the image above, to propel over the sand. Having flower beds that are raised makes it easier for wheelchair users to access their gardening, and they can mow their lawn using electric lawn mowers. A sewing machine can easily be managed or controlled using your arms instead of needing your foot to pedal the machine.
Alrighty, so taking a look at some tips and tricks for sexual functioning. And for positions in particular, it's super important to realize that now is not the time to get complacent on behalf of your client. We need to provide positioning options and let the patient or client decide which one they want to implement with their partner. A simple handrail placed above the bed as a headboard can be made to look quite aesthetically pleasing and also can aid in balance if the client wants to be in the top position. You can also consider other assistive devices, such as the intimate rider or the body bouncer. And also consider how a universal cuff can be used to assist in holding of foreplay apparatus. The Pleasurable Manual is a free and easy to read resource. You can find it with a quick Google search or open your phone camera and just scan this QR code on the screen, and it downloads the online PDF option. You can find many more recommendations in this manual. And what I like about this manual is it's very body positive and written out in layman's terms. So it's a good idea to actually print it out and give it to your client prior to initiating that and addressing that sexual functioning topic. In regards to pregnancy, remember that spinal cord injury is not a contraceptive, and it's possible for all women living with spinal cord injury to both fall pregnant and to carry their child safely and happily with some easy tips full term. Keep in mind that with added pressure on the bladder, as well as other added noxious stimuli, such as clothing now being a little bit tighter than usual, pregnant women are at a higher risk for autonomic dysreflexia. Keeping in mind that these AD symptoms can also mirror those of morning sickness, so blood pressure should be taken far more regularly than before. When planning or trying to conceive, consider a wheelchair that can grow with you, so one that's highly adjustable. Adjust additional weight, and the change in the distribution of this weight means that updated seating assessments should be performed regularly, and pressure care should be maximized during this period. Once your bundle of joy is here, then we need to consider how we transport your baby. So when transporting, make use of baby sling wraps, which can free up the arms to propel the wheelchair. The child should always be carried in front, as carrying on the back can cause weight shifting on the axis of the wheelchair that has not been accounted for. And it makes it easier to tip backwards, putting that baby in direct danger. So carrying on the back can also increase pressure over that sacral area and therefore increases pressure sore risk. So you want to carry in front. For quads, investing in baby clothing with adapted fastenings can also improve independence in childcare. And I'm sure all mothers know the pain of all these fastenings. So I think it's a good idea for everyone. There are options such as magnetic fastenings available online that ship to most countries. And the website you can find here and also on the last slide called Magnetic Me. Let's be honest, most cribs cost a fortune, so trying to find one that's wheelchair accessible at a reasonable price is not an easy feat. The main thing to consider when buying a crib after a spinal cord injury is that the wheelchair needs to be able to fit underneath the crib to get nice and close. The side of the crib can then be adjusted to slide out, and then just make sure that you add a lock function, which can only be accessed from the outside of the crib, so that baby can't unlock it themselves. And this allows the client to retrieve their child from chest height. And then also using a baby harness from a stroller works well as a harness as a handle to pick babies up from the floor. So here's just a video of a T1 para who first started picking up his baby up off of the couch, and then progresses to picking her up as a toddler from the floor. So let's give it a watch.
So I kind of wanted to show you how that works. First thing I do is just scoot forward in the seat, because leaning against the backrest gives me a lot more ability to just use my arms because I'm not supporting my body since I'm leaning backward. So far we've been using this pillow a lot. It works really, really well. So far she doesn't move around too much. She's only 2 months old. So we might have to go to a plan B once she gets a little more squiggly and stuff like that. But like I said, this is working so far. So if I'm going to go ahead and pick her up, luckily she's nice and sleepy right now. I would just wrap her up like this and then pick her up like that, like a sack of potatoes, and set her on my lap. So she's good to go. I change her and feed her on the dining room table. That kind of works for me because I can roll underneath the table and it's not like I'm trying to change her on a regular changing table that's beside the chair. So what I do is I actually straddle her across my forearm and kind of grab her thigh with one arm, with one hand, and then I'm going to push myself up with my left arm. So it's not super pretty, but I just wanted to show you how I do that. Ellie, you want to come up, or are you just going to play with your shoe? All right, we'll try this out. Want to come up? Come here, baby. So like I said, I'll just kind of have her like that. Push up with one hand, sit her up, and we are good to go. So say hi.
Just to note that the link for more videos like this and that YouTube video in particular is at the end of the presentation. All right, moving on to some community integration tips and tricks. So before we look at tips, we need to keep the following in mind. Mobilizing around the community may require re-evaluation of equipment and of the environment. We need to evaluate the terrain around the home, not just within the home. And this would vary greatly around the world. For example, in our country alone, it could vary from dirt roads and very inaccessible public transport to paved sidewalks and fully accessible private vehicles. The level of assistance required and available should also be evaluated. Community integration encompasses both the physical aspects and the psychological aspects. We need to look at navigating stigma and community response to disability. And community accessibility often requires significant and prolonged advocacy. So this is a process. It's not just one instant moment. So let's look at when you're out and about. Wearing a reflective jacket in the community when going for a stroll or when walking your dog increases your visibility, especially at night. You can attach a holder to the wheelchair footrest as illustrated in the image, so that you can also easily attach a dog leash to it. So having a look at shopping. If you're not a control freak like me, then online shopping is available in most countries and can be delivered within the day for various types of items, from groceries to gadgets. For those who like to pick each item themselves, using a long-handled reacher can assist to reach items on higher shelves. And lastly, avoid having to manage money if you have impaired hand function. Most banking apps actually have a cardless option on your smartphone that you can use to do immediate payments. And when manipulating a wheelchair around the shops, you can use a basket on your lap instead of the shopping cart. Although some shopping carts can be adapted, they're not very easy to travel with and often do get neglected. So let's have a look at traveling next. When mobilizing over rough terrain outdoor, adding a Velcro strap to the armrest of a motorized chair can prevent the arm from slipping off in higher level quads. Traveling with ice hockey pucks or something similar, such as wooden blocks, as furniture raisers, is an easy way to adjust the height of a bed when traveling and making it easier to transfer. If traveling alone, using the use of a camper's backpack instead of a traditional wheeling suitcase frees up those hands to propel. Just keep in mind that the wheel placements on the chair should then be adjusted to accommodate for the added weight on the back of the chair, so adjusting that axis. Alrighty, so if you enjoy camping, then the use of a hand sprayer as a mobile shower works especially well to wash genitalia. But for those of you who travel quite frequently, investing in a portable shower chair that can zip up into a small bag makes washing far easier. You can find the link for the one seen in this picture at the end of the presentation. Let's look at toileting. So when doing this out in the community, it's quite different from when you can do it in the safety and accommodation of your own home. Many disabled bathrooms are not accessible to multiple types of injury. If you're performing clean intermittent catheterization or CIC, then having a strap bag underneath the wheelchair is a really good way of carrying your CIC items that is discreet while still being quite accessible. In that bag, you should have a few necessary items, including some single-use catheters, additional lubricants, some hand sanitizer, a catheter extender, and a pipe cleaner in the event that the transfer to the toilet is not possible or that you're not able to get as close to the toilet as you usually would. This extender can be made out of a simple silicone tube, which you can get at almost any hardware store, and you should clean it using a proper pipe cleaner like the one in the picture after every use.
All right, when it comes to work for spinal clients, especially high paras, we tend to revert to suggesting some type of admin job, but we as OTs can definitely get creative and innovative around that. Don't forget, firstly, just accessing work environments is often the first hurdle. Even if a person can perform the actual job demands, just getting to work can sometimes be challenging, especially if you're in a country that doesn't have access to accessible public transport. But you can consider return to driving, might be required first with a driving assessment, or ensuring that they're able to transfer into a taxi quickly and safely. Another option to explore with employers, I think, especially after COVID, is remote working. It's proven to be quite easy to implement with technology. If your client isn't employed or is job seeking following the injury, you'll obviously need to consider their level of education and skills they have, as well as opportunities that are specific to your community for training. For example, for them to become an intern or an apprentice in a new field if they're required to first gain those skills. Driving is certainly an option for our spinal clients and is often a very meaningful occupation that people want to return to. For OTs working in that field, vehicle adaptations can be made, not only to typical vehicles or cars, which we often are the first to imagine, but also to other types of vehicles like minibus taxis or forklifts. And while on the topic of work, driving can be a vocation that if they are interested in it, and it can present more as a more flexible job, for example, being an Uber driver, which they can determine their own hours. Then for manual labor, we can definitely adapt by using cuffs to stabilize tools and adding extended handles, built-up grips to compensate for poor hand function, and also just to consider the environment, obviously access underneath tables, and then using things like drawers or tool cabinets on wheels that can allow for easier mobility and for them to maneuver things in the environment. Then computer work. So for lower level quads, consider this during the formation of the tenodesis grip. For going the traditional tenodesis grip, you can create a finger gun pattern that's shown in that image using the index finger and a gutter splint. When needing to press more than one keys, for example, we often have to press Alt and Control at the same time. You can bend a fork, or you can design a little implement using splinting material that can allow them to hold that and press those two keys that are spaced, a certain distance apart at the same time. And then for higher level quads, also considering a mouse stylus or dictation software. Then for reading or studying, a cushioned lap tray can be made. You just make the bottom section out of fabric, and you can use polystyrene balls and attach that to a firm board, or they can be bought, and you can use them for a variety of tasks while the patient is sitting up in bed or is seated in their wheelchair. For example, you can also place a book stand on top to make for easier reading at chest height, preventing too much tension on the neck, as well as preventing too much pressure on the lower limbs. They can lick their thumb, as was shown with the medication slide, how they can just lick their thumb to create a grip to create sufficient tension to turn the page. Additionally, they could use newer technology such as a Kindle or touchscreen tablet to turn pages. And then lastly, there are endless amounts of unique goals a patient may want to achieve, and sometimes we don't know the answer But I think that's the beauty of OT, is that we can problem solve and co-create with our clients. One tool I've found very useful that I think every OT department should have is a 3D printer. As you can see here, you can make durable, aesthetically pleasing, relatively low-cost assistive devices like a wrapping paper cutter, a tool to insert your phone charger, a bread clip, and an awesome seatbelt aid. It's a lot less intimidating to use a 3D printer than you might imagine. If you don't know how to design, like I don't, you can download and print open share designs from websites like thingiverse.com. They are listed on the last slide. And there are also companies that do design and custom make 3D assistive devices like Abilities, which is featured here that's based in California. All right. Thank you so much for joining, but please stay around for the Q&A. We have just listed the references and useful links that you might find handy if you want to go and find out more about a specific topic. If everyone can please post in the chat function, we'll have our moderators now just gather questions and pose that to the speakers. But once you've posted your question, if you can just pull out your phone and scan this QR code to evaluate the webinar, it just provides us with useful feedback for future webinars and also ideas of how to change things or topics we can cover in the future. I'm going to come back to this QR code. This will stay up. But I just wanted to let you know I will show this link as well. And this is the link to this presentation, which you can use. So let me just head back to the evaluation QR code. Please post that. Please post your questions and also give feedback. I just want to hand over to our moderators to find out if there are any questions that have come through.
No questions so far, Fiona. I guess my biggest question really to the team is just to ask what do you find your patients are asking all the time? Like what particular topics do you find once they're discharged from the rehab setting are the patients asking and you're trying to solve? Thanks.
Nica or Candice, would you like to take that?
So just from my side, I often get asked about the sexual functioning, especially when it comes to positioning in the bed. So sometimes the bed is not always, the mattress isn't the right texture, or they're finding those aspects when they're getting back home quite tricky. So I get a lot of questions about that. There is a lot more to it. I think there's going to be a whole other presentation about sexual functioning at a later point. So yeah, I just find that comes up most often.
Yes, that's quite true. We're hoping that the next presentation we do will be around sexual functioning primarily. Just a question from somebody about the 3D printing, and just elaborate a little bit on how you actually made those devices.
Sure. So if I just want to just touch briefly on the previous question, I'll go on to 3D printing. So I often found that clients found that the first few days going back home the most challenging, and they felt really equipped to be in a rehab setting, and they started to get comfortable in that hospital environment. But once they went home, it's quite a shock. And so what I would recommend is that once one of your patients is discharged, follow up with them 24 hours later, even if it's just on text or giving them the family a call. You might not have availability to see them so soon afterwards. And then just with the 3D printing, so I'm just going to go back to that slide quickly. So all of these images, oh goodness, gone a bit far. All of these images are tools, assistive devices that were made by this company called Abilities. You can follow them on Instagram. They also have a website and they're based in California. But I've made assistive devices. We have a filament 3D printer. So if I can recommend, there are two types of 3D printers. There are resin 3D printers and filament 3D printers. Resin 3D printers require you to buy resin, and it uses UV light and submerges it's in a liquid, and it prints this 3D model in this liquid, and once it's finished printing, you can emerge it from the printer. A filament 3D printer basically has a reel of plastic which it melts and slowly builds up the assistive device. I'm more experienced with using a filament 3D printer, but I'm not sure how to design. I do know that there's courses available. I don't know if it's part of anyone's undergraduate training, but I think it would be a very useful skill to learn how to design. So just on let me quickly navigate to that last slide here. So you can see that under free 3D printing design sites, there's thingiverse.com and myminifactory.com. Those are two very popular websites that you can search assistive devices and you can print assistive devices off there. But those are obviously, you aren't able to change them unless you have design experience. But I think it's definitely a field of OT that we need to explore more for assistive devices so that we can custom make them for our patients.
Great, thanks. And I noticed that there's a post from someone from the Czech Republic talking about one of their 3D printing designs with cushion. So maybe we'll include that into the this end slide, Fiona, if that's okay, as another idea. Yep.
That'd be great. Thank you.
Yeah. So a couple of other questions that have come through. One is around in a low socioeconomic environment with how you have worked with people with gathering and carrying water, and also if there's communal toilet use. So I don't know if anybody's got any comments they'd like to make about that.
Look, a lot of our patients we are in a low socioeconomic country. Most of our patients, fortunately, do have someone that will assist them. But they are, like, for example, it's maybe not for specifically collecting water, but on the Spinalis Tips website as well, there's quite a cool adapted wheelbarrow that is used for gardening. So if you have hand function, you can actually propel the chair and the wheelbarrow. So that could possibly be a way in which they can collect water. Otherwise, if you have someone that can help you collect water, obviously if you're alone, that might be a possibility. I don't know if anyone else maybe has other suggestions. And then with regards to, sorry, Nica, do you have a suggestion?
I just know that it was I attended a conference, and they're actually moving, or they're fighting to get collecting water as registered as an ADL, so that we have a greater focus on it in South Africa. I'm sure it's appropriate for many other countries as well. And they were looking at the floor transfer to be able to get down the bank of the river. So working a lot on those split level transfers to be able to gather water, and then adding the container either to your lap, so then transferring back to the wheelchair, putting the closed container on your lap. That works. The only problem is that the wheelchair, or not the only problem, there's many, but we need to make sure that the wheels of the wheelchair are accommodated for rough terrain, because there's not usually a river with this nice pretty riverbank. It's usually that you do have to go over very rough terrain. So it's a very multifactorial ADL. It's not the same with any other ADL. There's lots of elements to consider, and we need to look at it as in depth as we do as any other ADL. Yeah,
I just wanted to add, there are, if you just Google, it's called Hippo Water Roller, and it is I've never seen it being used with wheelchair users, but it is an adapted way of carrying large amounts of water. I think they're 20-liter drums that are basically a wheel that you can propel, and it's got a bar. So I could imagine that that's maybe something to explore. But I know for some of our clients, they start to, instead of collecting from a river, like Nica said, it's incredibly difficult. Just navigating that terrain, let alone actually getting the water. So water harvesting can be an alternative option. So with whatever dwelling they have, if they're in a shack or they have a small roof, to form a sort of low-cost gutter using PVC piping and collect water off their roof, and that can decant into very large buckets, can be a way to rather do that if you're in an area that does have good rainfall.
Yes, definitely a complicated area and something I've certainly never had to deal with. So appreciate your thoughts on that. The next question is around menstruation management in relation to IMCs in particular, but perhaps if maybe more generally along that topic, if there's any comments you'd like to make about that.
Yeah, it's something that I've also found patients quite early on, as soon as they get back home, they're starting to think about, especially because with trauma, obviously menstruation does stop for a while. And it can be something that's quite intimidating to get back to. What we need to keep in mind is that patients are often on blood thinners, especially prolonged wheelchair users, because of the lack of mobility with the lower limbs. So they're often put on these blood thinners long-term, which does also affect menstruation. So if they have any questions about that, please just refer them to their doctor, their treating doctor, if they're finding that they're having abnormal bleeding. And then there's tips and tricks in terms of managing a sanitary pad, as well as managing a tampon. Managing the tampon for a quadriplegic, if they're choosing to use tampons, the applicators are a good option. However, they do require the index finger. So it's not always easy to manage in your quads, where in a para, it's much easier to manage. But for quads, we recommend if they're using a sanitary pad, then that the sanitary pads get opened. So the tricky part is to open the sleeve of the sanitary pad. So as soon as they buy their sanitary pads, to just have someone open all the sleeves for them. And then to place one hand on top of the sleeve and hook their thumb onto the sticky bit, and then use their thumb as a way to peel the pad off the sleeve and then place it in place. It goes along with toileting, so making sure that your patient's in a position where they can remove their pants to a level where they can get access to that. But I think the same as with any woman, when you're going around these things, is to make sure that you're exploring it with your clients and that they're trying different things, because different things work for different clients. Whereas some people enjoy using a tampon, some don't. So it's looking at that preference and not just saying that they should do one way or the other. We also keep in mind autonomic dysreflexia in your higher paras. With the insertion of a tampon, it can sometimes trigger AD. So we just need to be aware of those.
So I just want to add on, Nica, I think it's important to educate your patients, particularly the difference, pros and cons between tampon use and sanitary pads. We actually don't prefer to use tampons just because they, especially in like your quads, because of the AD risk, as well as if they completely don't have any sensation, like with your full complete lesions, the risk of pressure sores. It sounds like a weird area, but it does increase the risk, and your AD risk increases a lot. So then just to educate them on, okay, when should we rather use a sanitary pad or a tampon?
Great, thanks guys. And the next question is around someone who's wanting to wash their back but is struggling to sit forward from the support of the commode. Just wondering if there's any simple things that you guys do with that.
So there are actually some techniques that you can, because obviously they're struggling with their balance. to actually teach them how to lean forward on the commode using their arms. And they actually lean forward to lie on their lap, and then they can use something, or alternatively, they'll hook their arm onto the back of the commode, lean a bit forward and use something like a long-handled sponge, which is just a bit of an easier way to get access to your back. And you don't actually have to necessarily lean too much forward. So as long as they have a bicep, it's actually quite a handy way to just hook in, lean a bit forward, and then your back is against or away from the backrest. Then you can access it to wash your back. I don't know if that maybe helps, if anyone has any other suggestions.
Yeah, no, that sounds like exactly what we would suggest, is that people find a way of balancing forward from the commode itself. Absolutely. And long-handled sponges, of course, assist with all sorts of tasks. Oh, thanks, Fiona. You're obviously reading the chat too, so that's great. The next question is around the NFC tags, and just if people have any examples of how they've used them, please.
So if I can just start with that, I've actually never used it with the clients, but I was exposed to NFC tags just with home automation. So I'd seen people use NFC tags to automate things in their house. For example, when they enter their home, tap their phone against it, and that it would automatically start playing Apple Music, or getting in their car and attaching it to where you have your phone holder, and as it touches it, it automatically links to Google Maps and starts directing you home. So I started personally using it, but when I started using it, I thought, why had I never used this with a client before? And I'm no longer in the clinical field, but I put this in the presentation because I was like, we need to get on this, because it's such a fantastic way, especially for pods that aren't able to type or have difficulty with that, to just have a quick and easy way to automate their life in their home. If anyone's used NFC tags before personally or with their clients, please post it in the chat. It would be great to read what you've been doing.
Perfect. And just along the similar sort of technology line, just a question about what your experience has been with voice activation software and technology, how successful you found that.
If I can just quickly jump in here. So in South Africa, I don't find it very successful with my patients because, look, we have a lot of languages, national languages in the country. And I found that a lot of the voice activated software technology is more based on like the American or UK system. So unless you get the accent right, it doesn't really work. So in our context, I don't find that it works that well, just because of the language barrier and more the accent, that you end up getting such a big miscommunication. I don't know if anyone else has had successful experiences, but I haven't. I
agree completely. I've also, even with quads, I've rather looked at typing with a stylus, just because I haven't had a stylus in their mouth, just because I find it really tough. Even myself, my accent is a bit different, and so I really struggle. But our patients who are Zulu speaking, Xhosa speaking, their accents are very heavy, and that's majority of our population. So it's not something that we have regular success with, but it would be interesting to see other countries if they have the same experience.
Yeah, please post in the chat if you've found it to be very helpful, if there's a specific product that you found particularly easy to use with your clients. We didn't have access to that sort of software in the setting I worked in, so I can't really comment.
Yes, so we do use in Australia the Dragon Dictate style of voice activation, but I agree. I think you want reliable, and sometimes the simple solution is the easiest one. So finding a sort of reliable stylus that you can actually use may well be the solution. I think particularly with the voice activated controls of different devices, that can also be quite frustrating if your accent is a problem. Yeah. So just a comment from Amina from Nigeria, and she was just hoping that we've got somewhere of a manual with all of these ideas in it, because they don't have any rehab centres. So as Joe's rightly said, Spinalis Tips is a good website, but I don't know that there's anything any other way of getting these things all together apart from downloading the presentation, I guess.
If I can just jump in, so it's a useful resource to use is the SCIA website, SCIA community.
You want to post it in the chat, Candice, then we can
yes, so I'll post it in the chat as well, but it's also it's very nice for the patients themselves, but there's also the eLearn SCI, which I'll also post, where actually for each different profession. So if you're the physio, the OT, you can actually get a step-by-step guide on what you should basically focus on. So that might be a good resource if
the e-learning one, the eLearn spinal one, I actually did it when I hadn't even graduated yet. So it's very user-friendly for people who are more on a layman level. You can look at various tips, but I also think that at the end of the day, we're a community. So my name's there. I'm on all social medias. If you have a patient and you're not sure about something, or I'm happy for you to reach out and give ideas where necessary.
Perfect, that's great. So just a comment about going back to the menstruation management side of things. Just wondering whether anybody has a comment about the use of the menstrual cup. So the device that you can leave in for an extended period and wash out at the end of the day, or the comment that's made is that in the Czech Republic, the medical staff seem to be a bit divided about whether that's a good idea or not.
I think it's divided across the world. I think you need to keep in mind the hand function that your patient has. It is very hand function intensive if they're going to be manipulating it themselves. And I don't know even if research is up to date with I don't think there's any set research findings that will show whether it triggers AD or not. Yeah, I agree. I don't think anyone's unanimous, but I think that trial and error does go a long way. I think any woman trying it for the first time is a little bit nervous. It is foreign and it's not very widely accepted yet. So I think that we need to look at it on a client by client basis and, be with your patient maybe when they insert it for the first time, or assist them in inserting it, and see if it does trigger AD in that client specifically. Obviously if they're a lower level, you're at lower risk. So yeah, I don't think we have a set answer on that yet, unfortunately.
Yep. I think it sounds like you're agreeing with the person who's posted that question.
Very much so.
So that's good. And then just there's a query about where to hire a van from in Australia and New Zealand, and I might post a reply to that online. So there's a number of different rental companies, and probably going through specific ones in relation to Australia. I'll write that out in the chat instead. Also comments about things like the ISCoS e-learning as a website to find different information, which is good. And oh yes, and Candice.
And Nikki, if I can just jump in there, just for the last few minutes. Just for those that aren't aware, there's an annual scientific meeting or gathering by ISCoS every year. This year it will be in from the 8th to the 11th of October. It's going to be held in Edinburgh, Scotland this year. It does change venues every year, Abstracts for those who wanted to present, unfortunately abstracts is closed, but registration is still open. The early bird registration fees are still available. So I'd really encourage everyone that would be interested in attending that to navigate to iscosmeetings2023.org if you'd like to attend.
Fiona, can I just ask you to please put up the presentation barcode again?
Oh, sure.
They're just asking in the chat if they can have the link again.
Yes, sure.
There we go.
All right. Actually, with that, I'm going to then, Nikki and Aretha, thank you so much for moderating. I just wanted to thank again also our speakers, Nica and Candice. Yeah, your expertise is really valued. It's been really exciting to put this together, and this will be available for those who missed it at the beginning. This recording will be available on the ISCoS YouTube channel, so that, yeah, you can share it with colleagues, or you can watch it again if you've missed anything. But please feel free to access the presentation, and you're welcome to share it with others. We really want to get all this information out there as much as possible. All right. Thanks everyone for joining. I'm just going to end the meeting now. Cheers.